Zweli Mkhize is at the Brandwag Primary School in Bloemfontein, where screening of about 600 pupils is taking place after a parent of one of the learners tested positive for the novel coronavirus. SABC News reporter Aphumelele Mdlalane is there covering the story for us. Aphumelele, very good morning to you. What's the latest there?
Good morning to you, Blaine, and also to the viewers at home. Like you said, we are at Brandwag Primary School. This is where Health Minister Dr Zweli Mkhize came in the morning, and he is currently addressing the parents. This after the reports that a parent tested positive from COVID-19. Therefore, there was an urgent meeting called that there should be a screening that is taking place. And when we're talking to the principal, he did mention to us that it's about 600 learners that will undergo this screening process from grade 1 to grade 3. And also the parents have been called to do the screening. And earlier on, we saw Dr Zweli Mkhize already talking to the teachers about them not being to panic on this pandemic, and also telling them that this thing will be, of course, under control if we work together, and also telling them about the importance of social distancing, and also about continuous washing of hands, saying that because this is primary school, now this is what they're supposed to preach to these learners. But later on, we expect the Health Minister, Dr Zweli Mkhize, to give us a media briefing where he will be outlining the results, as we heard yesterday already when he was giving the media briefing, that the numbers are likely, of course, to rise beyond 200. Now we will, of course, hear from a media briefing, but currently, as I'm talking to you, the minister, the minister is just joining me right now. Okay. He will just be giving us an update. Minister, we are here at the primary school, and you just talked to the parents. Tell us what's exactly happening. Do you see the panic happening in the school?
Well, I think, we should expect that parents and teachers will be panicking. That's why we need to talk to them. We've spoken to the parents, although I think they are getting more relaxed when you explain the nature of the virus. I think it's natural that people will feel a bit uncomfortable. It's coming for the first time here, but after this, they'll be able to talk to the others, and that will relieve the panic. But what is important is for parents to know how we're approaching the infection. We test the ones who are positive, we test the ones who have symptoms. If they are positive, then we go to the next layer of contacts, and thereafter we wait for the results, quarantine them. When they are okay, then we'll wait for 14 days. If they do have the infection, then we go to the next set of contacts. We want the parents to understand that. We've also spoken to the teachers. They must teach the children about hygiene, about the spread of the infection, about how to block their mouth and nose when they cough, and they must also understand it's a matter of time. Coronavirus will come around, and one day we'll be all used to it, but our bodies right now don't know this virus. So we have to just make sure that we reduce the rate of the spread so that it slowly gets to be familiar with our bodies without causing a huge pressure on our health services. And community mobilization is more important than treating one person in this case.
Minister, another important question is that we've seen also on social media platforms where people were asking about these gloves and also the mask. If you can take us through the importance of having this. Are we supposed to put on the gloves and masks?
Well, those people who are working in areas where there might be a high level of infection, then they can be, we can recommend the gloves and the mask, but it's at the moment it's voluntary. We only use it for areas where we think the likelihood for infection is very high. The gloves and masks are expensive and also in short supply, but we just need to deploy them where they are needed most. Right now, the WHO recommendations are really more that you only focus on areas where you're dealing with too many symptomatic people, where you want to use those gloves. It's just a precaution, but people can use them. We encourage that. Anyone who wants to use them is fine. But right now we're not supplying masks. We're not doing so except in areas where it's focused. Where we've got people who have got a high likelihood of meeting people who have got the virus, we will then recommend that they must take more protective clothes, particularly in the health services where people are having the symptoms and so on. We need to just focus on those kinds of areas.
And we expect a media briefing from the Minister?
Yes, there will be a media briefing. We'll give you the total numbers. We'll also explain what has happened in the Free State. These are new cases, but at that time we'll take you through one by one so you understand even how we're approaching the the prevention as well as the tracing of contact. We'll talk to you in the next hour or two.
Thank you, Minister, for your time.
Thank you very much.
That was Minister Dr. Zweli Mkhize, of course, giving us an update of what he's been doing in this primary school, also reiterating that he has told the parents and also the teachers on the importance of social distance, and also that this issue of panic won't help anyone, but also gave assurance that later on we will be having a media briefing where he will be outlining or rather breaking down the reports, especially concentrating on in the Free State, because we understand that there is more reports to come out. For now, it's back to you, Blaine, in studio.
All right, Aphumelele Mdlalane, live for us from Bloemfontein, the Free State. We thank you very much indeed for your reporting. We'll get back to Aphumelele in a short while, as and when that press conference happens with the Health Minister, Dr. Zweli Mkhize.